Today I'd like to talk to you about curvatures in your spine, the importance of them, why you need them, and why it is a good idea to take proactive steps in ensuring that you have a nice curvature in your neck and lower back. When a baby is born, he spends most of his time on his back. A couple months later, he learns to flip over on his stomach. The baby starts looking around because there are a lot of visual stimuli in his environment. This is the point at which that neck curvature called the cervical lordosis starts to form. Months go by and that baby now is walking on all fours. And this is the point where the lumbar lordosis starts to form. When the baby starts to walk, the neck and lower back curvatures start to really take shape. Babies who have just learned how to walk, they have the best posture. They're standing up straight and it looks effortless. Their head is directly over their spine, there's no slouching, and everything looks perfect. As adults, we're subject to the forces of gravity, we're sitting in chairs for long hours, and the various activities of life have the cumulative effect of slowly eroding the curvatures of our neck and low back. Now this sets the stage for problems. When you have a nice curvature like this, it distributes the weight where it's about 80% being absorbed by the disc and 20% on the facet joints. If you have lost your curvature, then you're going to have a situation like this, and pretty much all the weight is going to be absorbed by the disc. And that's the point at which you start experiencing degenerative disc changes. This is when your disc starts losing fluid content, cartilage starts eroding because there's less nutrients. You start to see osteophytes, which are basically bony projections, and if they occlude a space where a nerve is transiting through, then you could possibly get nerve pinching. You're likely to get numbness and tingling in the arm all the way down your hand. If it's in the low back, then you'll get sciatica or pain down the buttock, the back of your leg. If you have inexplicable neck stiffness, or you find that you can't turn your neck to one side as much, you feel that there's just something not quite right, get an x-ray of your neck to determine if you have your cervical lordosis, your curvature, and to determine the state of health of your discs. If the x-ray shows that your neck has flattened out, you might want to consider visiting a chiropractor to see if some spinal manipulation can correct the problem. If the chiropractor is experienced with exercise rehabilitation, he or she will prescribe for you a set of exercises to help arrest the progression of degenerative changes in your neck. You may also want to try devices like this one. This is the Posture Pump Spine Trainer. I made a video of this previously. There's a link to it here on the screen. What this does is you do it for a couple of minutes every day. It essentially bends your neck back very gradually. The other thing you can do is to get a cervical roll. This is like a cylindrical pillow. You could get it online on Amazon.com, or you could even just roll up a bath towel and place it under your neck. Use your neck muscles to press the crown of your head so that it touches the floor, and hold it for 10 to 12 seconds and repeat about 6 times, and do it daily. And don't forget massage therapy. Years of sitting in front of a desk staring at a computer screen can shorten your anterior neck musculature. If they're tight, then they just can perpetually keep your neck in that forward crane position. So find a good massage therapist and let the therapist work on those muscles, the back of your muscles, your upper trap. Do some passive and active stretching, and do that in combination with the posture pump and the cervical roll at home. And this would be an adequate program to help restore and rehabilitate neck curvature so that there's less stress on it and you'll be less prone to developing neck pain as you get older.